Tilting your saddle nose up by just one single degree increases perineal pressure by 30%. The mistake most riders make is sliding their saddle forward to fix a long reach. Don't do that. Stem length dictates reach. Saddle position dictates knee tracking and power delivery. To find your baseline, we use the KOPS method, knee over pedal spindle. With your cranks perfectly horizontal at 3 o'clock, drop a plumb line from the very front of your kneecap. That line should perfectly bisect the center of your pedal spindle. You don't have to stay exactly at KOPS. Moving forward shifts load to your quads, favoring higher cadences but increasing anterior knee strain. Moving backward recruits glutes for grinding bigger gears, but heavily stresses the posterior knee. Pick your poison. Here is the geometry trap that ruins most DIY fits. Because your seat tube is angled backward, sliding your saddle forward 10 millimeters effectively drops your saddle height by 3 millimeters. If you shift fore-aft, you must raise the post to compensate. Next is saddle tilt. Use your phone's digital level app, not your eyeballs. Start perfectly flat. Tilting nose down past 2 degrees guarantees you'll constantly slide forward, crushing your wrists. Conversely, nose-up tilt destroys soft tissue. Lund's 2018 study proved just 1 degree of upward tilt spikes perineal pressure by 30%. The only exception is time trial positions, which tolerate a 2-degree nose-down tilt to accommodate forward pelvic rotation. Because these variables interact, you must follow this strict order of operations. Adjust saddle height first, fore-aft second, tilt third. Finally, you must re-verify your height, because changing the fore-aft and the tilt absolutely altered your leg extension. Action step: grab a quality Wera hex set, a plumb line in your phone. Zero out your tilt. Find your KOPS baseline today and lock it in. Stop guessing, grab your string and measure it.